I became a patient here at Mustard Seed February the 8th of 2017. I had had a major employment change in my life, and I went from having most of the necessities for life to almost having nothing. And being a breast cancer survivor, I'm a breast cancer survivor since 2013. And I did need, excessive medical help, just maintaining my body and everything. But I also had other health issues. I'm diabetic, I have high blood pressure, I have glaucoma, breast cancer survivor, as I've said. So I went to social services, Guilford County Social Services, and they recommended me to Mustard Seed, not far from my house. You can't beat that. So then I came into the Mustard Seed Community Health, and I met Dr. Mulberry and all of the staff here, from Pat to Stephanie, and they've just been exceptional. Dr. Mulberry is, I can't say enough about her. She's very detailed. She takes time with her patients. I've been with her for hours sometimes, even when I've come in. And she really sits and talks to you. She noticed some emotional stress that I was having. And I sat and talked to her. I even cried a little bit. So she recommended me for some counseling sessions, which really did help me. I won't say I'm totally cured, but it helped my stressful situation. It helped me sitting talking about it. They recommended things that I should do to better my situation. I am very proud to be a part of Mustard Seed, to be a patient here, because I can come here for any of my medical issues, any of my health issues, even my emotional issues. Dr. Mulberry has even checked my feet. I don't have pretty feet. So it's so many things that all I have to do is think Mustard Seed, and I know it's going to be taken care of. And I'm very proud to be accepted here in this program.
I get community members come in, and one man told me, he said, having the Mustard Seed Clinic here saved my life. He said he felt like he would have been dead because he couldn't get to a doctor. He could barely walk, couldn't hardly get in and out of his car because of his blood pressure and diabetes situation. He said he probably would not by now be an amputee because of the fact that he didn't have a doctor.
There have been times with patients where if we didn't live over here and we weren't going in and out of their homes, we would not have been able to intervene adequately. And so we had a family here, and still have the family here, who is Burmese. And they speak a dialect that's hard to find an interpreter for. And she had a brain tumor that had been misdiagnosed as a psychiatric problem initially. And ultimately, they found the brain tumor, but because they couldn't communicate with her in the hospital well enough, they felt they were just going to leave it, that she didn't understand what her future was with this brain tumor. And because we were over here, we found the people that could speak both English and her Burmese dialect, and were able to communicate with her what the long-term complications of this enlarging brain tumor were going to be. And once she understood it, she elected to have something done. And so we found a specialist, after talking with specialists here in Greensboro at Moses Cone, that there was somebody that this is something they really focused on at Wake Forest. And she ended up at Wake Forest. She had her surgery done, and she had debilitating headaches. They're gone now. She's living a really healthy, happy life at this point that would not have happened if we weren't over here and making those connections with the people that live here. And I think that that's what it's all about. That's why we're here.